Diabetes is on the rise for multiple reasons. So it is important to recognize and prepare for it. The population is increasing in number, and lifestyles are changing for individuals, for societies, for nations. Many things we're not doing right, but of course circumstances have changed. So we don't say they may not be particularly what we are doing wrong. We are assimilating what we call development or changing lifestyles, because we must change, we must adopt them. However, they also have their consequences. We are eating largely what would be the same things, yet they have undergone value addition for whatever reason. So they are refined, especially the sugars, the salt. Sugar in itself, in drinks, in cakes, in multiple refined foods, are diabetogenic. Salt in food storage or table salt that we add, and other sources of salt in life are a source of hypertension. And over time, salting drives high blood pressure. So salt, sugar in the element within the areas of food industry and diets in the households are a source of diabetes and hypertension. Plus, of course, the genetic makeup. We may not particularly know was existing because the circumstances were a bit different. But there are also times when we know father, mother, brother may have diabetes. Therefore, the risk is there. So people need to live. People need to live recognizing that they have a chance of developing diabetes at one point or the other in their life. Diabetes is a reality. It's a disease, lifelong disease. It is costly. It is an additional responsibility. You have to take medicines every day. If you don't do that, and you don't do it, or you do it and you don't do it well, you have a risk of developing complications. You can get blind from diabetes, you can get kidney failure from diabetes, you can get heart attack or heart failure from diabetes. You can have your limb chopped because of diabetes. Much more so when you add other lifestyle challenges like cigarette smoking to them, then you enhance your complication rate and profile, and within your lifetime you can lose your eye, require another kidney if it doesn't kill you, get an amputation, and all those problems.
As a country, we need to go back to where we came from. Start to eat good food, fresh food that are prepared right from the farm. We should concentrate on eating more foods that are not related to meats. We should be eating plant foods, because plant foods are known to be the best foods that a human being can eat. But we have tended over the years to start to work towards eating meats. And these meats have their own untoward effects on our health. Previously, as Africans, as Kenyans, we have had particular types of foods that have been good and rich in nutrition. But in the recent past, Kenyans have moved towards using processed foods, foods which are not properly stored, foods which have been stored for long. And these foods have brought us a lot of problems in the sense that we are now eating what in quotes we call junk food, most of which lead us to develop diseases which were not common with us previously. And that is the reason why we are seeing for the first time in Kenya the non-communicable diseases hypertension, obesity, diabetes. These are diseases that are on the increase. They are increasing because what we are eating is not appropriate for us, and we are eating the wrong types of foods. We are also not concentrating on eating fresh foods. We are eating foods that have been stored for long. The preservatives that are contained in these foods that are used to preserve the foods are also leading now to conditions like cancer. No wonder cancer is a disease that is starting to increase in our country. The WHO has recently come up with media reports, and it's not just WHO, all organizations that deal with human health globally have told us what we already know, that processed foods, foods like sausages, grilled foods, foods that are preserved for long are not good for our health. We must go back as Kenyans and start eating fresh foods. And that is why, as a ministry, we are now launching the guidelines so that we can start to look back and to start to support, especially those who have HIV, so that they can be eating well, so that their body's immune system can be improved based on the good foods, and that the diseases that are now starting to come on board, like the non-communicable diseases, which are becoming more common in people infected with HIV, can start to go down.